Guys, welcome back. Today we are going to discuss about rehabilitation. It is an essential component of universal health coverage. It helps to optimize the function and reducing the disability and promoting independence for all. So, what is the demand or what is the growing need of rehabilitation? Rehabilitation is essential alongside health promotion, disease prevention, treatment, and palliative care. It helps individual be as independent as possible in daily life and participate in education, work, recreation, and family roles. Around 2.4 billion people live with a health condition, different type of health condition that could benefit from rehabilitation. Aging populations, chronic disease, and disabilities are increasing worldwide, and that's showing the growing demand of rehabilitation. According to the studies, in some low and middle income countries, over 50% of the people do not get needed rehabilitation. It all shows the importance of rehabilitation. According to WHO, what is rehabilitation means? It is a set of interventions designed to optimize functioning and reduce disability in individuals with different health conditions in interaction with their own environment. So, WHO means World Health Organization. So, according to WHO, rehabilitation means a set of interventions, that means planning, designed to optimize functioning, increase the functioning, and reduce disability in individual with different kind of health conditions in interaction with the environment. And if you want to simplify it, I will say rehabilitation means work with the person and family to address the health condition, modify environment, provide assistive products, educate for self-management, and adapt tasks for safe, independent performance. So, in conclusion, rehabilitation can help with challenges in thinking, seeing, hearing, communicating, eating, or moving. So, it is a set of interventions designed to optimize the functioning and reduce the disability in individual with any health condition. Who might need rehabilitation? Anyone may need rehabilitation after an injury, surgery, illness or disease, and age related declining in functioning. Here you can see some examples of rehabilitation intervention, and after reading this, you will get an idea on what is rehabilitation, how it take place, how it will function. Speech language training to restore communication after brain injury. It is an example of rehabilitation intervention. Physical exercise programs to improve muscle strength, movement, and balance in stroke and Parkinson disease patients. Home modifications to enhance safety and independence for older adults. Cardiac rehabilitation education teaches safe exercise for heart disease patients. Prosthetic training. It prepares amputees to use prostheses, includes making, fitting, and refitting. Medication for spasticities to help children with cerebral palsy improve movement. Social skills training to support people with schizophrenia, autism, or intellectual disabilities. Psychological therapies to address emotional distress and after spinal cord injury. Vision rehabilitation to train the individual with vision loss. Intensive care recovery to improve breathing, prevents complications, and speed recovery after critical illness. These are all examples of rehabilitation intervention. Basically, the nature of rehabilitation is person centered. That means it is highly individualized. So it must be highly individualized. It must focus on the person's goals and preferences. Also, we have to select flexible setting based on the situation of the patient. Either might be hospital, especially inpatient or outpatient, physio and occupational therapy clinics, community locations such as homes, schools, and workplace. So basically, rehabilitation is person-centered in nature. That means we have to focus on individual. We have to put the patient in the center of care while planning rehabilitation interventions. Then The workforce of rehabilitation, or who is working for rehabilitation, means all the specialist people, physiotherapists, occupational therapists, speech and language therapists, prosthetists, clinical psychologists, rehabilitation doctors, nurses, healthcare professionals, assistants, practitioners, surgeons, community health workers, and other paramedics also involved in rehabilitation workforce. What is the benefit of rehabilitation? It reduces the effect of disease, either it is chronic or acute, and illness and injuries. It reduces the effect of diseases and illness and injuries on person. It helps to works alongside medical and surgical intervention to improve recovery and outcomes. It prevents and manages complications, especially important for spinal cord injuries, strokes, and fractures. It helps to manage chronic conditions. That means it helps to slow or minimize disabilities from conditions like cardiovascular disease, cancer, and diabetes. It helps in self management and also helps in assistive support. For example, it equips individuals with strategies, devices, and pain management approaches. Also, it supports healthy aging. That means it helps to maintain function and independence as people grow older. So these are all the major benefits of rehabilitation. And also, in terms of investment, it is cost effective. Rehabilitation, if you implement in proper way, rehabilitation will reduce the expensive hospital stays and prevents readmissions. It will enable us to return to work, sustain independence, and reduces the need for long-term caregiver or financial support because we will make them more independent. Also, it helps to gain, or it will helps to achieve sustainable developmental goal 3, that is ensure healthy lives and promote well-being for all at all stage. So what is SDG? That is sustainable developmental goal, and we will learn in detail in another video. Then, rehabilitation is an investment with cost benefits for both the individual and society. It can help to avoid costly hospitalization, reduce hospital length of stay, and prevent readmissions. As rehabilitation also enables individuals to engage in or return to work and employment, and it minimizes the need for financial or caregiver support. And rehabilitation is an important part of universal health coverage, sustainable developmental goal 3. Then, there are different misconceptions about rehabilitation. So, this video will clear your misconception. Because most of the people are thinking rehabilitation is for disabilities. No, it's not just for disabilities. Rehabilitation benefits anyone with an acute or chronic condition, injury, or impairment that limits functioning. It is not a luxury. It is an essential health service, not just for those who can afford it, not a last resort. It should begin as soon as a health condition is identified and often alongside other medical interventions. So it is not the last option. It will start along with other condition. It is not a luxury thing only for luxury people, or it is not the last thing. Universal access. High quality, timely, and affordable rehabilitation should be available to all to achieve full social, economic, and health benefits. So it is not just a for disabled people, or it is not a luxury thing. It is not the last resort. It is for everyone who need support. Those who are undergoing any kind of issues related to their health. So if you want to discuss in detail, I will say that rehabilitation is not only for people with disabilities or long-term or physical impairment. It is an essential health service for anyone with an acute or chronic health condition, impairment, or injury that limits functioning. Rehabilitation is not a luxury health, nor it is an optional service to try only when other interventions to prevent or cure a condition fail. So it is not the end one, it is not the luxury thing. Okay, it means timely, high quality, and affordable rehabilitation intervention should be available to all. It means deliver rehabilitation alongside other health interventions. So it is not only for the people with disabilities, it is for everyone with any kind of short-term or long-term physical impairment. And why needs remain unmet? Why all people are not getting proper rehabilitation means there are a lot of reasons. Insufficient funding, Lack of proper policies and planning is the major reason. Then urban-centric service, like few rehabilitation options are available in rural area. It might be because of improper funding or insufficient funding and improper planning. Then high cost, like out-of-pocket expenses with little or no funding support. Then shortage of skilled professional. Okay, in previous slide, we had a discussion regarding this task. So in that task force, you saw many people. So skilled professional, all that people are skilled people. So in many low and middle income countries, fewer than 10 per million population. So shortage of skilled professional also is reason to unmet needs. Then lack of resources, to do the exercises, to explain the things. There is need of different assistive technologies, equipments, and consumables. So inadequate assistive technologies, equipment, and consumables also. That means lack of resources also a reason for lack of proper rehabilitations. Then research gap. No proper researches is taking place to find out the reasons. Then poor referral pathways. That means ineffective system for connecting patient to rehabilitation. So the healthcare professional should connect the person to the proper rehabilitation service. So these are all the reasons why needs remain unmet. If the question is means this is the reason. Then according to WHO. So, what is WHO's response on this unmet need means? WHO is strengthening the approaches to ensure that rehabilitation service can reach to all who need them. And this involves making rehabilitation part of all level of care, including primary care, and ensuring it is incorporated as part of universal health coverage. So, based on researchers, okay, based on the research on these unmet needs, okay, what is WHO's response means? WHO is trying to ensure rehabilitation services and it should reach to all people. That is the motto. This involves making rehabilitation part of all level of care, especially from primary care, and ensuring it is incorporated as part of universal health coverage. And WHO's work is guided by the resolution on strengthening rehabilitation in health system adopted at the 76th World Health Assembly, implemented through the Rehabilitation to 2030 initiative as requested by the resolution. And the major area they have focused include leadership and governance, proper leadership, proper governance to find out the unmet needs, to implement the plans in proper way in all aspect of care, especially in primary care itself. Then financing and integration to universal health coverages, health information system enhancement, service delivery enhancement, workforce development enhancement in terms of competency frameworks and evaluations, research and evidence strengthening, emergency preparedness and response, and advocacy by WRA, that means World Rehabilitation Alliance. So WHO is working on this, and by 2030, okay, so we will get a lot of changes to provide ultimate proper rehabilitation to all people, those who need proper support and care. Okay, now when it comes to, so when we look into NHS England rehabilitation, it is led by Chief Allied Health Professional Officer. And what is the aim of NHS England's rehabilitation service means? Support independence, enable people to live full lives, and return to work where possible. So support independence, enable people to live full lives, and return to work where possible. Rehabilitation within the NHS focuses on helping individuals recover from illness, injury, or surgery to regain their independence and improve their quality of life. It involves various services and therapies tailored to individual needs, aiming to maximize physical, cognitive, social, and psychological functioning. And what is the approach they are following means work with commissioners, providers, clinicians, and service users to improve services that meet local needs. When it comes to India, the Rehabilitation Council of India was set up as a registered society in 1986. On September 1992, the Rehabilitation Council of India Act was enacted by Parliament, and it became a statutory body on 22nd June 1993. The Act was amended by Parliament in 2000 to make it more broad-based. The mandate given to the Rehabilitation Council of India, RCI, is to regulate and monitor services given to persons with disabilities, to standardize syllabi, and to maintain a central rehabilitation register of all qualified professionals and personnel working in the field of rehabilitation and special education. The Act also prescribes punitive action against unqualified person delivering services to person with disability. So Rehabilitation Council of India was set up in 1986. And the act was amended by Parliament in 2000 to make it more broad-based. The mandate given to RCA is to regulate and monitor services given to person with disabilities. And Rehabilitation Commission guidance, April 2016, includes evidence, good practice examples, and practical commissioning advices. And also, there are some tips to follow. Like main focus areas include perspective of patient and families, local solution tailored to needs, whole life course adults and children, covers physical and mental health rehabilitation, economic cases for rehabilitation for individual and society. So if you read Rehabilitation Commission guidance April 2016, if you will get all these informations. Then principles and expectation for good adult rehabilitation, which is enacted in 2015. National consensus define what good adult rehabilitation should look like, and it developed by service users, carriers, the people, those who are working in healthcare professional, carers, commissioners, clinical network, and national clinical directors. And the 10 principles and expectations also you can see if you read the principles and expectation for good adult rehabilitation 2015. So, in conclusion, rehabilitation is not optional, it is a core health service. Universal access ensures healthier, more independent lives, reduces health costs, and supports economic growth. Strengthening rehabilitation now prepares health system for the future. All right, so this is about rehabilitation. So, just think about this misconception and clear your ideas. So, rehabilitation is not only for people with disabilities or long term physical impairment. It is an essential health service for anyone with an acute or chronic health condition, impairment, or injury that limits functioning. All right, then rehabilitation means what? Rehabilitation is person centered. Rehabilitation need anyone who is under a surgery, or anyone may need rehabilitation after surgery, injury, illness, or age-related decline. All right. So, in conclusion, it can help with benefits include it can help with challenges in thinking, seeing, hearing, communicating, eating, or moving. And WHO says that rehabilitation means a set of interventions designed to optimize functioning and reduce disability in individuals with different health condition and in interaction with their environment. All right, guys. So this is rehabilitation. Hope you understand. Thank you.